Well, welcome everybody. This is the second session in our in-depth week for human and social services, focusing on children's mental health this week. And we are in this session doing family and navigating the system. I'm here with, this is Molly Rowland with Hand in Hand and Meredith Myers from YPN. They're going to talk to us a little bit about mental health systems and navigating those systems for families. So welcome to the session. I'm Emily Andersen. I'm with the Gazette, and I will be moderating this session. For audience members, just know that you can submit questions at any point. We'll be taking audience questions as we kind of discuss, and we'd love to hear some of the things that you guys want to hear about. And yeah, so starting off, let's start with just some introductions. I think let's do Molly and then Meredith, if you could both just introduce yourself a little bit and tell us a bit about your background and kind of your connection to this session topic.
Great. I'm Molly Rowland from Hand in Hand, and I actually work more with families specifically who have children or adults with a developmental disability, but who may also have mental health needs. And my current role at Hand in Hand is Chief Program Officer. I've worn many different hats at Hand in Hand over the last 20 years or so. And now I get to have more of a overview of all the programs and all the services we provide.
Awesome.
And I'm Meredith Myers. I am the Director of Programs at YPN. I've been here for about 3 years. YPN, we focus on parenting education from prenatal to age 5. So we definitely talk about mental health and well-being of children and parents alike. Prior to that, though, I worked 17 years in mental health and care coordination. So I have quite an extensive background on children's mental health.
Yeah, definitely. Awesome. So for both of you, can you tell us a little bit from your own perspectives? I know you both come from kind of different parts of the system. Tell us a little bit from your perspective, from the work that you do, what you see is the current state of family support systems in Iowa and how we got to where we are now. Go ahead, Molly.
I was going to say I can start with that. I know just in my time working at Hand in Hand, but also working with people with disabilities in Iowa, we've definitely become backed up is the best way I can explain that, as far as services available, even as far as the Iowa Medicaid waiver, which I work very closely with our families and participants, can have over a 2-year waiting list for just a slot on that waiver. And I know that just is one example of, how long families have to wait to have their needs met and services provided.
Can you tell us a bit about, sorry, Meredith, didn't mean to cut you off, but Molly, can you tell us a little bit more about that waiver and kind of what that process looks like? Sure.
So the Iowa Medicaid waiver, Iowa is one of many states that have waiver services through Medicaid. In Iowa, it's funding and services for people who have a disability. Also, there are 7 different waivers, and one of them happens to be child mental health waiver. And individuals will qualify for each of the waivers for different reasons, but this is a great resource for families and individuals to get their needs met based on their level of care and access to services. It reduces out-of-pocket costs for families, which I know is really, really important, and gets people in touch with respite services, therapies, all different things that are needed. So it's a great program.
Yeah, definitely. Sorry, Meredith, go ahead.
Going to follow up on that. So the Children's Mental Health Waiver is really a great program, but the wait list is quite extensive. I think one of the really big benefits to it is for a family who doesn't typically qualify for Medicaid due to their income, they will automatically get Medicaid once their child qualifies for the Children's Mental Health Waiver, which can open up so many other doors, including like behavioral health intervention services. It helps reduce how much a family might have to pay for a prescription or a copay for therapy. So beyond the services just within the waiver, it really opens up a lot of doors for families in Iowa.
Yeah, definitely. Do you know the history of that waiver? How long that's been in effect and kind of where it originated?
So that waiver started in 2005. So we're coming up on the 20-year mark. And when it first started, not a lot of families were familiar with it. But slowly people have learned about it. And so it is really in high demand. And unfortunately, there's just not enough funding to provide those services to the families that need it. Every year, the family has to go through a renewal process. They have to make sure that their child has an SED or serious emotional diagnosis, and that they're utilizing services. So it's really intensive. It's meant to keep children out of placement facilities. It's meant to keep the child in the home with their family.
Right. And I would say even the longer history, Emily, is just, originally to, as Meredith said, just keep individuals in their community with their families, in a place that they choose versus having to be placed in a setting, that's not their home community or not near their families. So, even while the child mental health waiver is the newest of the waivers, it goes much farther back than that. And it's about, keeping people out of an institutional kind of living versus, being able to live with their families, which is what we want.
Yeah. How does that affect, especially children? I mean, I know that's going to be a thing for adults as well, but I feel like especially with children having to be separated from their families to get different kinds of care, what kind of a difference does that make, being able to be treated and stay in your community and stay with your family versus going to a treatment center?
Go ahead, Emily. Meredith.
I think that it's really, a child with a mental health diagnosis isn't just treated in isolation. It's really a family situation. So the entire family needs to be a part of that treatment process. And if a child is, from Cedar Rapids and they're in Des Moines, it's really hard for the family to be a part of that process and really heal the family so that the child can come home successfully. So being able to provide those services in the home just makes a world of difference in the quality of care families are getting.
Right. And I would even add that isolation, preventing isolation is the goal of all Medicaid waiver services. It's making sure that people are included. So.
Yeah, definitely. And does that make a difference in the aftercare process where when someone, if you're going to a center somewhere to get treatment, obviously it's going to be a different environment than when you're arriving home afterwards. So having that treatment in your own home, does that kind of make that difference in how the aftercare goes and how successful it is, do you think?
I would say totally, yes. And it allows families a chance to see, to be able to see the treatment in action and know how to follow up with that at home.
I think there's also a little bit better of continuity of care, because if you're receiving that service in the home, you can kind of have step down services with that same agency, with those same providers. Whereas if you're inpatient somewhere, you're getting services, then you have to transition to a different agency or a different provider when you go back home, most likely. And so you're rebuilding relationships and building rapport. And so there's kind of a lapse in being able just to have that continuity of service.
Yeah, definitely. We've got a couple questions about the waiver in the chat here from Wanda Johnson. She's asking a few different things, just more details. Looks like, is there a way to know where you are on that list periodically? And what all does that waiver cover? And then who is it required for? Kind of a few different questions. We can start with, is there a way to check where you are on that wait list?
I believe there is. I would think that the same, this is a tough question, because I would think that the same way they applied for the waiver would be a way that they could also access answers about where they are in that process. I know it's long, it's 2 years or more for most families. So don't lose heart if you haven't heard back and it hasn't been, that time frame. And but I would say definitely being proactive is, I definitely recommend that. Do you have more to add to that, Meredith?
So I believe you can reach out to the slot manager or the DHS income maintenance team. They should be able to give you a better idea of where you're at on the wait list. But I think it's also critically important that if a family moves, make sure that you're reaching out to DHS and giving them your new address, your new phone number, because if your slot comes up and you don't respond within 30 days, you lose your slot and then you're back at the bottom of the wait list. And there's rarely exceptions to that.
Yeah, definitely. So another question, Wanda also asked about who requires those waivers, and she clarified who requires it, as in what coverage or facilities, are there specific coverage or facilities that require that you have that waiver before you can receive assistance?
So I guess I'm not quite sure of the question. Once, like for the children's mental health waiver, once you would qualify, once you receive level of care that yes, you do need these services, there are certain agencies in each county within Iowa that are able to provide those services. And your case manager should be able to get you hooked up with those agencies and get those services started.
Right. And I can speak less from the child mental health waiver, but waivers in general. Hand in Hand is a provider of the health and disabilities waiver and the ID waiver. And, again, just exactly what Meredith said, you can find out what each waiver covers by going on the DHS website. There is a lot of information about each one of the 7 waivers and the different services that are offered. But then even working with case management to say, these are the things I want. And then they should be able to help you decide what providers are there to provide those services.
Gotcha. Thank you. I'm going to also, Molly Eslick in our questions also sent a link to the DHS website, and I think I'm just going to copy that over here into the chat. I guess, I don't know if our audience can see the chat. I think they can just see the question answer anyway, but I'll point out that that's there, that there's, there are links to where you can check those things. So that's, thank you for that also. So moving forward a little bit off of the waivers, I guess that is a big part of funding and getting things available to people. But what other, I guess, besides funding and those waitlist difficulties, what other roadblocks are there that you see that are kind of standing in the way from where we are now and where we would like to be ideally in an ideal society for these mental health programs?
I think there's just a lack of providers. So many people get their education and then they move out of Iowa. So just, if the state could figure out some sort of program to incentivize psychiatrists and therapists just to stick around in Iowa for longer, I think that would be really beneficial to all the families looking for services.
Right. And I think I would add that, families don't always know that these services exist. And I know that, we find at Hand in Hand that often, we're the first person they hear this from, and their child might be 10 or 12 or 15, And so, in a perfect world, I would say people are notified immediately from their physicians, from their teachers, other resources, so that it's not so unknown.
Yeah, definitely. Along that vein, when a family starts to notice possible signs of a mental health need or other disabilities, where would you advise them to go immediately? I guess where's the first place to talk to someone to get that information to help them succeed?
I would say often it starts with having that discussion with your child's primary caregiver, and just having them do developmental screens and those kind of things to kind of see, where your child is developmentally with other children their age. I know the AEA in our area also can be a big help with that for children that are in preschool or in the schools, to do assessments. And those can be for lots of different things, from, speech to, like you're mentioning, disability services and things like that. And they can also give professional opinions and help get the ball rolling with, a diagnosis, or at least kind of moving towards helping that family.
Yeah, definitely. Have any thoughts, Meredith, to add, or anything?
No, I think Molly covered it. I think it's always a great option to start with your primary care physician. I mean, they see kids all day long, so they know what's appropriate, what's not appropriate. And as a parent, trust your instinct. If something just doesn't feel right, seek out some answers, because your child's better than anybody else.
Right.
Yeah, definitely. And you could probably speak to this, Meredith, as well. Are there any specific signs that you would advise parents to watch for or look for in their kids to look for mental health challenges?
So I think with mental health challenges, it's always good starting off very young, giving your children the vocabulary to talk about their feelings and what it is that they're feeling, labeling those emotions, so that they have those words to help you later on, because you don't always know what they're thinking. But if you start to notice your child is very different, is acting differently, if they're suddenly not playing with toys that they've always played with, or they're not outgoing when they go to the playground, and they're just kind of playing off by themselves, and usually they're the social butterfly, all of those could be concerning warning signs that you might want to look at a little bit further. If they're suddenly not sleeping, or if they're sleeping all the time, again, things to be mindful of, things that are different in your child.
Mm-hmm.
Yeah, definitely. So what kinds of things are we looking at, I guess, programs or things that you guys are working with currently going forward with this, looking to future possibilities for improving the system, at least from what you can in your current positions?
I would say, for me and for our team at Hand in Hand, it's just that knowledge is power. And for any family who is seeking our services because they feel that their child does have some additional needs, or, may just have doubts even, I really feel like we can help that family along the journey and give them knowledge about the waiver program, because it can be, I know just from experience, it can be scary for families to, I guess, realize that there might be additional needs for their child, and they do need support through that process. And they do need people to say, I will assist you with filling out this application. I can give you more information, and I think a lot of families do feel overwhelmed by that. And so they do need someone to be in their corner and say, I'm here. I'll be, your support through this.
Yeah.
I think, Cedar Rapids is just a great place for resources. There are so many agencies that assist with children's mental health, from Tanager Place Foundation to Four Oaks. And they're, like Molly said, there are just so many people who are willing to step in and help out. So don't be afraid to ask those questions of, I have this form that's 15 pages long and I don't even know where to start. Somebody will gladly sit down and work with you to get through that process so that you can get your child on the wait list, or just, get services, whether that's, just an initial assessment and yep, your kiddo's fine, just keep an eye on them, mom, dad, or maybe we do need something that's a little bit more in depth.
Yeah. Right. And there are many programs that, I know Hand in Hand, as an inclusive program, we don't require waiver services to participate in our program. And so I know there's other programs like that as well. So, it doesn't mean that you have to be waiver qualified before you start and receive the services that Meredith was mentioning too.
Yeah, definitely. And how accessible are some of those services to families when you have, or families that have kind of different situations, especially those who may be living in some of the more rural parts of Iowa? Meredith, you mentioned that there's a lot of different services in Cedar Rapids. But if you're living somewhere where there's not as many options, what are their options? Where can you go?
So I think COVID really opened the doors for a lot of options, a lot of things. We had to get creative in how we were doing services. And so I think telehealth is still very much an option for a lot of places. And if you're in a more rural community, that might be your best option. If you have Medicaid, Medicaid will pay for your transportation to and from medical and mental health appointments. So if, transportation is the barrier, you can get reimbursed for cost, or they can provide transportation. So I would say don't be shut off to options. Keep talking to people, because there's ways to get to where you need to be to get your services and your mental health addressed.
Right. And even, I had mentioned to you, Emily, that, although we're a Quad City based organization, we have families that come from Clinton County, that know, that want their children to be part of our programs. And so they might use it as a trip to shop in the Quad Cities and receive a few hours of respite services. There's, don't be afraid to kind of look outside your community if there's limitations to what your community is providing. And I totally agree with the telehealth services as well. I mean, that was, one of the bright spots of, I think, COVID, was us realizing, hey, there's other ways to do things as well, rather than just direct care.
Yeah, definitely. Were there any other ways that COVID kind of changed or affected the work that you guys do?
Oh, yeah. Definitely.
Yeah, I was going to say it changed everything.
Yeah. I'm trying to think of some of the impacts, really. We did participate in telehealth services for several months as an organization, just to keep our, a lot of our programs are social recreational kinds of programs. And so just getting other, our groups together, and so they could see each other socially, even if it was on a screen, and playing games and things like that, just to have fun when everyone was so isolated. And gosh, I'm trying to think. I think we just started thinking, we always felt like we were someone who did a lot to adapt to families and their needs, but I feel like it just pushed us to even do more. So that never hurts, right? To expand our circle of how we're reaching out to people and understanding where they are, and trying to meet them where they are. So
definitely.
I would agree with that. I know at YPN, one of our big programs is parenting-based education, and we moved almost immediately from in-person to on Zoom. And families, identified, we feel so isolated right now. We already struggled with depression and anxiety, and now I can't see my normal group of people. So just being able to meet online once a week for an hour, kind of gave them some sense of normal.
Yeah, definitely. I think that kind of affected everybody. I mean, even this webinar here went online during the pandemic because of the same thing. It used to be an in-person event, but yeah, and it's all really interesting to see how that affects health and the wider opportunities that people have.
Right.
There's another question in the chat here from Wanda, where she mentioned she said, I heard there was a certain process of waivers and testing that, it just jumped. I think we responded to it and it just jumped into the other spot. Certain processes of waivers and testing the needs to be done before your child reaches 18 to continue receiving assistance after. And what are those? So I guess drawing from that, my thought is also just where, what are the necessities when transitioning? We talked about the waivers earlier, going back to that a little bit. If you're on a child mental health waiver, what's going to be the process when you turn 18 of transitioning to other options for help with funding and getting the services you need?
So I've stepped away from the mental health world a couple years ago, so it may have changed slightly, but at the time you would reach out to your county. In Lane County, it's the East Central region, your mental health and disability services, and chat with them about what options you would have available. It could be that you would qualify for rehabilitation services. That would be similar to a waiver, or it could be that the county is just going to fund whatever services that you need in a slightly different way.
Right. And I would just build on that as well, to say that I do encourage families to apply for waiver services before their child becomes an adult at 18, because it does change slightly, as Meredith said, to more county-based funding. And that can be, a lesser amount. The slots may be fewer, and the services. But if you're on the waiver earlier, you're going to have, as long as you keep those level of care needs the same, and as long as you're staying accurate with keeping, as Meredith mentioned, your address updated and your annual care plan meetings and things like that, it can, last a lifetime, the care and the services.
Awesome. What are the options for people if they are on a wait list for those waivers, or if they're, just needing more services than what they can get through that system? I mean, what other options are there for funding? Are there other options, or are people just kind of struggling to fill those gaps themselves?
So there are options out there. Unfortunately, they're not all super well known. In Lynn County, there's some wraparound funding. So if you fill out paperwork and you have a certain diagnosis, maybe they can help pay for a copay, or they could help cover a prescription that's not covered by your insurance. There's also the Children's at Home grant, and that's for the entire state of Iowa. I believe that's more geared towards developmental disabilities. But if your child has a mental health diagnosis, there's also a chance they may have a developmental disability and qualify for that as well.
Yeah, and there, what used to be formerly called Hawkeye, which is, the Medicaid, the insurance part of the Medicaid, or the medical care side of it, is still something people can apply for, and so that they could access more of their medical needs if they have those, before they would qualify for a Medicaid waiver slot as well. So sometimes that would be something that I recommend. I know some of the funding here in the Quad Cities area can be seasonal. So we find, especially at Hand in Hand, we have a bigger summer season. We have more enrollment at that time when students are out of school, and we do a summer camp. And I know that there's always a lot of funding to be accessed during that time. And so, it seems to be more seasonal that way. But I love that Meredith had other resources as well for the Lynn County.
Yeah, that's awesome. All right, we have another question here from Molly Estlick. We touched on this a little bit, but if you have any other thoughts to add, she asks, are discussions being held at a state level to bring or increase different types of services to rural and smaller towns?
I feel like that's always an ongoing conversation. I don't know about you, Molly. Unfortunately, again, it's just the lack of people to fill those needs. In the rural communities that I've worked in, there's always small agencies that maybe have one or two staff that try and do the best that they can, but they definitely aren't large enough to fill the need of that entire county.
Right. Yeah. I agree with that, because I know that many people do drive into the Quad Cities to have, or even to Iowa City, for some of their needs to be met, as far as, the medical community and even services. So, I know that the state of Iowa is working on a lot of these issues way above my level. But, anybody who's worked with the state knows that it can be very slow too. The progress can be very slow. And so, I know that they do, town hall meetings, and they invite providers to discuss these things and needs that come up. And they talk about the next initiatives that are coming, becoming available. And so I would say I would just be a voice for those things. I would advocate for the things that you would like to see. And if I find out more about how to do that in a really effective way, I'll pass it on.
Of course, yeah. So even within larger areas in the state, do you feel that there are sufficient services for everyone that needs them, or are we lacking just in general on being able to fill that role, not only in rural areas, but in some urban areas as well? Are there just things that are missing in the system to make sure that everyone is getting the services they need?
I would definitely say yes to that. And I think some of it does have to do with, unfortunately, some providers not accepting Medicaid services, for example, not accepting that. And I know even for the intellectual disabilities waiver, which is more common for hand-in-hand participants, even to get that psychological evaluation, that can be a long waiting list to have providers who are willing to do those evaluations just to qualify, to qualify or to renew your ID waiver spot. So, that's, and I think it does speak to some of what Meredith said, where people are moving out of the area, and they're seeking other things to do, or they're going into more private practice, which isn't as inclusive for people who use Medicaid services, maybe. So those are a couple of things that I would love to change.
Yeah, for sure.
Yeah, I would agree. I think that I think the need far outweighs the resources that we have available. And I don't know that that's exclusive to Iowa, but I do know that it's an issue in Iowa. And I think given the effects we've seen from COVID and the isolation and the anxiety that kids are having because they're not sure, who's sick, who's not sick, if they should still be wearing their mask or if it's okay to take it off. I think, there's been a huge increase in anxiety in kids, and there's just not enough people to provide those services at this point.
Yeah. So when you have a family has maybe a child who is needing services, and they're kind of going through the whole process of figuring out the waivers or on the wait list or figuring out where to go to seek those services that they need, how does that affect the family as a whole in your experience? How do the other children in the family have to deal with that, or the parents, or what kind of burden does that create for the family as a group?
Like I said earlier, it's not just an issue for that child. I mean, it's the entire family. Parents are exhausted from chasing possibilities, from filling out paperwork, from telling their story again and again. They're desperate to find anything to help their child, and they probably don't know what it is at this point. Other siblings, they're probably tired of that one child always getting all the attention from mom and dad just out of necessity. And there have been families I've seen where those other children have started to display some mental health issues just because they're not getting maybe the time and attention they need from mom and dad. And it's through no fault of their own. They are absolutely in survival mode, and they're doing what they need to do to make their family continue to go.
Right. And we also see, especially with families who have a child with a disability, a lot more single parents. So a lot higher divorce rate or separation rate among those parents. So sometimes we're even working with a single parent who just has such a challenging job to begin with as a single parent, but then they have additional needs that they're trying to get met. And, and we also sometimes, I know we work with families whose the parents also have some additional needs of their own. And so they need lots of support themselves to stay on top of requests that come, through the mail, or, just kind of making sure they understand what they're signing up for as far as the waiver goes and the services and why it's important. So, it really, there's a lot of other pieces to that. And then I also think too, that the other children in the family who, definitely need that time from their parents that they may not have to give. So I know that they also have to sometimes step up and grow up a little faster than maybe their other same age peers for that reason.
Yeah, definitely. And how can we as a community and as a state do more to support these families that are going through these types of situations?
That is a great question. Gosh, I think even something as simple as just not passing judgment on the child and the family that you see in the supermarket who the child is in the middle of a meltdown. You know, my background just growing up might be like, oh my gosh, that kid's like such a brat. But, you know, having worked in the mental health field, it's like, I don't know what that family's going through. I don't know what crisis they might be facing. So just offering that parent a kind word, or, you know, a knowing glance, or even offering, is there anything I can do to help you right now? Could really just make a huge difference in that parent's ability to make it through that moment.
Right. Yeah. And I definitely, I mean, just if you're a parent at all, you know, getting those bad looks from people because your kid's melting down is like, okay, you know, you feel like a failure. So just, I would say any child that's doing that, you know, anytime you can extend grace to somebody, but especially someone who's got a pile of challenges on top of, you know, just parenting itself. And, you know, and I also think, you know, a lot of our families, you know, their children who have additional needs will come to hand in hand because there aren't, you know, they can't ask the neighbor next door to care for their child's needs, or even grandma and grandpa or someone close to them may feel unprepared to take care of additional needs. But then maybe those family members could instead invest their time in the other children in the family and give them some one-on-one time, and let them do some of their favorite activities, because I know often those kids have to kind of you know, they have to kind of accommodate the needs of the child who has more needs. So, you know, often their needs are kind of secondary, and that's just that's a challenge, you know, that's a challenge. So
Yeah, definitely. That makes sense. And are there ways, oh, go ahead. Were you going to say something, Meredith?
I was just going to say, I think, you know, being, if you're one of the parents who are struggling with a child with a developmental disability or mental health need, reach out to other people. I know it's scary and it's hard to share your story because you don't want to be judged, but there is a large community of people who are willing to wrap their arms around you and help, I guess, shoulder some of that burden. And a lot more people struggling with it than what maybe you realize. So there are people out there who share a similar story and people who want to help support you.
Yeah. Where would you look to find those kinds of communities?
I was just going to add, I'm just checking it right now. There's a Facebook group actually, and I'm going to make sure I get it right here. Let's see. Yeah, this one's a Facebook group called Special Needs Families of the QCA, so Quad Cities. But I mean, I think they answer questions for each other that could be, you know, nationwide kinds of answers, and it's a support group. It's, hey, has anybody ever had any success with any of the pediatricians? Mine retired, or no, just, you know, specific to their child or disability. And they seem to be a really great group as far as resources. I've learned a lot just from following that page, and, you know, having, you know, just learning more and being a resource for families in the future. So that's one I would recommend.
Definitely. Can you repeat the name of that Facebook page one more time?
It is Special Needs Families of the QCA.
That's awesome. And I'm sure there's plenty of other groups out there who have similar support systems, and that's great.
Yes. So thanks to the families who started that that group and just groups like that. It's invaluable.
Yeah, totally. So as a society, are there ways also that we could, I guess, support families in general in order to, I don't want to say prevent, because you can't really prevent mental health issues a lot of the times, but to prepare for those situations better and to help families in general be more equipped to help each other and to support each other, and so that maybe there's less of a load to be carried there. Does that make sense?
So there, is mental health first aid classes for both adults and children. If you ever get the opportunity to take that class, it's pretty in depth, but it gives you a good idea of some steps that you can take as a layperson to be able to assist someone who's having a mental health crisis until they can get professional help. So that would be one option. I think, just also reaching out to legislators, letting them know that, hey, we need more funding, we need more support to help the communities so that they can get through some of these mental health crises that are going on.
Yeah.
I don't think I would add anything else to what Meredith said. I think.
Gotcha. That's interesting. I hadn't heard of mental health first aid before. What exactly does that kind of look like? Can you go into a little bit about what those classes entail?
It's been a bit since I've taken the course. Probably it's time for a refresher, but it kind of gives you like warning signs. Like if you see somebody experiencing these things, here's some steps that you can take. If you find somebody in a crisis mode, like these are ways you can help keep them safe until a professional therapist can show up or till they can get into somewhere to seek that professional help. They're usually offered multiple times a year here in the Cedar Rapids area by various agencies. So I would just say keep your eyes open for when those trainings are. A lot of times they're free as well.
Yeah, that's awesome.
And I would also say just, I feel like there's still a lot of stigma around mental health. And even for someone like me who's worked in this field for many, many years, and I feel like if you have experience with mental health in your own life or family members, sharing that with other people, if you're brave enough to do that, it often brings other people to share their stories, and they might also then be able to get the help that they need or think of different treatment options that they haven't thought of yet. And that can be very valuable as well.
Molly, that's a great point. I think somebody who's gone through it, it's easy to look from the outside into somebody's life and be like, oh my gosh, their life is so perfect and and then what you don't realize maybe is they're personally struggling with mental health or their child is. So just being willing to share your own experiences could really make a difference in somebody else's life, because you always think someone else has it perfect, and that's rarely ever the case.
And then just check your own, I guess, misconceptions about, I would say that about mental health and disabilities, kind of check to see, like, are they in line with facts, or are they in line with things I was taught, or a bad experience I had, or movies, or whatever. Sometimes what we have in our brains to tie to something like mental health is not, it's not based in reality, or it's not based on real people. And so you sometimes have to think about that and try to educate yourself on, what am I really thinking about this? And can I change the way I'm feeling about it?
Yeah, definitely. And that definitely would be something that impacts younger people a bunch, I'm sure, with social media and
yes,
things. Yeah. How do you see that impact, I guess, different between, I know, Meredith, you kind of work with families as a group, and Molly, you work with all kinds of different ages. How do you see the impacts of, I guess, the differences between youth and children and the way that they view themselves and their mental health, as opposed to adults that are seeking help for other things?
Oh yeah, I think we've come a long way as far as helping children recognize, and share their feelings. I would say maybe a couple decades ago, people didn't really encourage their children to talk about those things or feel those things, and I know that is that's definitely helpful to anyone to kind of recognize, hey, I need someone to talk to. Hey, I need to get these feelings out. And I think also as far as, awareness of different needs that a person with a disability have. I think, everything from, Target having a clothing line that makes more accessible dressing for children. It's actually universal for all kids. If you've ever tried to, wiggle a child's foot into a pair of shoes, you go, why don't they all have zippers on the side, or, special ways to help get the feet in, and just things like that. The more that I've worked with people with disabilities and universal design, the more I think, why don't we just make these changes across the board? Like, why are we fighting against this so much? So I think we've definitely come a long way, and I think marketing and social media helps spread that message. And I'm encouraged about kids that are growing up now and having a better sense of what being with a person with a disability is like, and having experience with that when they leave junior high and high school, instead of just kind of going into the world and saying, having their own like fear or misunderstanding of a person with a disability. So
Yeah, definitely.
I definitely think, the language that you give kids to use early on makes a big difference. And just how you talk about it. Mental health is talked very differently in my household than how it was in the house I grew up in. And so my kids have a very different view of it. And I think it's going to differ based on how you grow up, but just putting those words to it. And kids talk about it at school. They get classes to talk about their feelings and maybe why someone is acting slightly different. So just giving them that language is really important.
Yeah, definitely. What are some of those language, I guess, specific words, or are there specific things that you would advise in including in that language to give to children, specific things to talk about, or ages when it would be a good time to start talking about these things with your kids?
I think, as soon as they are talking, give them the words, tell them what the emotion is that you're seeing, and explain, oh, you're angry. This is, you're angry because mommy took away your toy because you hit mommy. Even that young, they're connecting, they're making those connections. So give them that language. Don't water it down. Don't just always say happy and sad. You're feeling anxious today. You're worried. Let them understand what those words mean from a very early on, and don't shy away from the questions that they have about it.
Right. And sorry, and even, having I have a son who's just finished first grade, and he, would tell me things like, oh, I would say, oh, I'm so excited that you're doing so well in reading, or your spelling or something. And he would say, oh, but, this child that I know in my class, he's only on list, a lower number. And I even just hearing that and telling my son, well, guess what? Everybody learns at a different pace. And, that person may be they may be excelling in their math skills, but their reading is slower to develop. Or, if they point out differences of a person, just model how to go up and talk to that person. I happen to have a lot of participants I see out in the community, and my son has been around, that. And so I'll be able to walk up to someone who uses a wheelchair and talk to them. And then my son asks the questions, that kids are just curious about. And, it's letting them know that is someone that's, they shouldn't have to be afraid of. They don't have to worry about asking questions, and just, the right way to go about treating someone who is different than they are.
Yeah, definitely. That makes sense. Yeah. So I think we're getting close to about 10 minutes left. If anyone has, just audience members, any other questions for Molly or for Meredith, now's the time to send them. But kind of just looking at going forward from what we've discussed today, and if there's anything else that we haven't talked about that you wanted to bring up, what would you say to citizens of Iowa as far as moving forward and making progress in the future, making mental health more accessible for children and for families, and making the system easier to navigate? Is there anything that you would want to make sure people can walk away with?
I think, just keep asking questions. If you don't have the answer that you want yet, keep asking questions, because somebody will refer you to someone else who may refer you to someone else, and it's exhausting. And hopefully you'll find that right person sooner rather than later. But there are so many people out there who have been in your shoes and they want to help. So just keep asking.
Right. And I think I would just reiterate, don't be afraid to talk to your child's physician or teacher. And, if you're feeling that there might be, your child might be having some delays or some additional needs, because it really does start with, I think, that desire to find out more. And I know a lot of families do struggle with that, and I do understand that as well. But I think just ask, as Meredith was saying, just ask, and be prepared to learn. So,
Yeah.
And I think that sometimes we're afraid to ask because we're afraid to find out what the answer is, and no answer is better than an answer that we don't want.
right.
But time and time again, we've learned that early intervention is often the key to reducing the long-term impact of a mental health diagnosis or developmental disability. So
Yes.
it may be scary, you may not want that answer, but at least once you know, then you know what steps need to happen.
Right.
Yeah, definitely. And for parents and for the children as well, just knowing that they can ask the questions that they have and talk to people. I think that's a great thing. Well, sorry, go ahead. Do you have anything else? All right. Well, thank you so much for coming to talk with us today, Molly and Meredith. We really appreciate it. And thank you for our audience members and your wonderful questions to get us going. And I think this has been a really great discussion. We want to say thank you as well to Tanager Place, who is sponsoring this in-depth week with the Gazette, and for all of our web people who have helped put this together. They're running our Gazette people here who are running the questions and everything. And then just a reminder for the rest of the week, we've got a session tomorrow at the same time at noon about intakes, assessments, and diagnosis. There's a session Thursday about children's mental health in law enforcement and the courts. And then Friday, we'll be talking about mental health resources in schools. So be sure to tune in for those sessions. And thanks for being here. We appreciate it.